Welcome to the Naval Medical Center Portsmouth Neonatal Intensive Care Unit. Here at the First and Finest, we are equipped to take care of the smallest of patients. We are a 24-bed unit, level 3 NICU, with the latest technology and capabilities necessary to help your little one grow big and strong. This video serves as a jumpstart for your time here, outlining what to expect throughout your journey within the NICU. Thank you for watching and allowing us to take care of your little one. The NICU is a locked unit, so please use the phone next to the door for entry if someone is unable to assist you. Visiting hours are 24/7 with the exemption of shift change. Due to our ward being an open bed unit, we ask that you kindly leave the bedside from 06:45 to 07:15 and 18:45 to 19:15. The nurses will be giving a narrative to the oncoming nurses in order to ensure safety and quality of care for your little one. We ask that you respect the privacy of our little ones, so please do not knock on the door or ring the phone during this time. There is a maximum of 3 persons at each bedside at any time. Have more family members who want to visit? Feel free to swap out. Who is allowed to visit? Anyone with an infant identification band, visitors designated on the visitors list. Visitors not listed on the visitors list are allowed when accompanied by a parent with an infant band. Visitors must be 12 years or older, except for siblings. And for siblings, we have specific dates that we'd like you to take note of. April 1st to September 30th, they must have documented immunization records to visit. You are responsible for their safety and must provide direct parental supervision at all times. October 1st to March 31st is RSV season. Only age 12 and older are allowed during this season. This also includes siblings. When your little one is admitted to the ward, you will be asked to fill out a visitor information sheet, which is kept in a binder at the front desk. Whenever you want to enter the ward, you will be asked to sign in. Want to call and check in on your little one? No problem. Feel free to call the front desk and the ward clerk or charge nurse will patch you through to your baby's nurse. We do ask that you be patient with us, however. With labs, exams, hands-on care times, and all-around hustle and bustle of the unit, we may ask that you call back when the nurse is able to better assist your request. Safety of your little one is our #1 goal. Just as a reminder, please respect the privacy of our NICU families. Do not approach the bedside of another patient and do not ask questions about other patients. When bedside rounds are conducted, please be courteous to patient privacy. All visitors must perform a 2-minute scrub before entering the NICU. There is a sink located next to the main NICU entrance as well as inside. Scrub from the elbows down with all watches, rings, and jewelry removed. Always rewash or sanitize your hands before touching your baby, after all diaper changes or when hands become soiled, and after use of any devices such as cell phones, cameras, and tablets. Phones are known to carry bacteria and can be harmful to our infant population. It is imperative to sanitize your hands after the use of a device at the bedside. While we're talking about cell phones, let's go over our device policy. Personal phones at the bedside can be used for pictures and texting. FaceTime or video chats are only allowed in cases where the other parent of the infant is deployed and cannot be present. This is due to our HIPAA policies. This will be considered on a case-by-case basis. No phone calls are allowed due to signal interference with NICU equipment. If you need to take a call, please step out. Feeling under the weather? Limit visits if you have any of the following: a fever, cold symptoms, or have sick siblings at home. When at the bedside, if any linens, pacifiers, or bedside toys become soiled or fall to the floor, please alert your nurse. Additionally, we ask that you stay away from strong-smelling perfumes, aftershaves, or body sprays, as this could start an allergic reaction in some of our patients.
Hi, I'm Dr. Colette Grable, the current medical director in the NICU here at Naval Medical Center Portsmouth. We welcome you and your newest addition. Medical services are provided by a highly qualified staff of neonatologists, pediatric resident physicians, neonatal nurse practitioners, and our nursing staff. In-house medical consult services are available for many pediatric subspecialties, including cardiology, neurology, gastroenterology, surgery, endocrinology, hematology oncology, genetics, and ENT. Additionally, we have our respiratory therapists, dietitians, speech and occupational therapists, ward staff, and corpsmen who are able to assist you 24/7. Want to know who's who? Take a look on our badges. You should see our credentials listed below. If you ever have any questions, please feel free to ask your medical provider at any time. Again, welcome to NMCP's NICU, and thank you for letting us take care of your little one.
While at your baby's bedside, you may notice a variety of equipment. Your child will have several cords and wires attached to them, but don't be alarmed. Each one is playing a vital role in letting our medical team know how your baby is doing. Each child will be hooked up to a monitor that will display heart rate, respirations, oxygen saturation, and blood pressure. You may ask yourself, why is my baby's monitor alarming? This could be for a variety of reasons. Alarm limits are set parameters. Anything outside of these parameters can trigger an alarm. Bradycardic episodes, or dropping of the heart rate, may occur when an infant bears down to stool, has reflux, or even during feeds. Some require stimulation and some do not. Desaturation episodes, or drop in oxygen saturation, can occur when an infant isn't getting enough oxygen or due to positioning or movement of the foot. It's important to remember that some alarms can be misleading. False alarms are caused by your infant moving around, leads being misplaced or falling off, or waveform issues. Always look at your baby to see if they are pink and breathing, regardless of an alarm, rather than focusing on the monitor. In any case, look to your nursing team if you are concerned. We are there for you. Now let's talk about some more invasive lines. Your child may have a variety of lines, drains, and tubes, but all serve a purpose in helping your infant on their way to discharge. Many will have some sort of line that allows your medical provider to administer medications, fluids, and give blood. These may include intravenous catheters, or IVs, umbilical arterial lines, or UAs, umbilical venous lines, or UVs, or peripherally inserted central catheters, PICCs. In any case, your nurse will tell you which lines allow for you to hold your infant and which lines require the infant to stay in their bed. The lines are often your child's lifeline to recovery. Moving infants from their bed can dislodge these lines, which would require immediate medical attention. If you are able to hold your child, look to the nurse for assistance when placing infant in and out of bed, and always give yourself enough slack on the lines in order to ensure they are not pulled by accident.
Hi, my name is Rachel. I'm one of your respiratory therapists here in the NICU. Your child may have a variety of different respiratory equipment at their bedside. These are in place to help your child's breathing. We have several systems in place here in the NICU to include conventional ventilation and high-frequency ventilation, which provides a stable airway of ventilation for your child using an endotracheal tube or an ET tube. These infants can only be held under special circumstances. Most of these children will be sedated and require very little touching from friends and family in between care times. We call this low stimulation. Additionally, you may see your child on a CPAP or a nasal cannula. Both of these devices provide breathing assistance to your baby as well. Typically, you can hold your infant if they're stable and tolerate position change well. This is often at your nurse's discretion. As always, if you have any questions, feel free to ask.
Some children may also require a nasogastric or orogastric tube, NG or OG. These orange tubes allow ventilation and decompression of free air in the belly, and also allow us to feed your little one before they are adequately taking everything by mouth. And finally, your baby's home while they are here in the NICU, the isolette. The isolettes are used to provide warmth and humidity to your little one. You will often see them covered for minimal stimulation purposes. Please do not raise the top of the isolette without nursing assistance. Be mindful when moving the isolette up and down due to lines and tubes that could become dislodged during the movement. Always use the portholes for access to allow for minimal heat escape during your hands-on care. This keeps your infant cozy while also helping to maintain internal temperatures. You can always turn on the heat window control to give a little extra boost of air during hands-on care. There are several different ways that your baby can receive nutrition. The most common way is either mother's breast milk or formula. Breast milk is an important part of your infant's health and well-being. It contains nutrients for both brain and intestine growth. Parents are encouraged to bring in fresh or frozen pumped milk. We suggest pumping at least every 2 to 3 hours to keep your milk production up while baby is admitted, because they may or may not be able to breastfeed initially. Per NICU policy, fresh breast milk must be used within 48 hours from the date pumped. If not used in 48 hours, it must be placed in a freezer before the 48-hour mark. Thawed milk must be used within 24 hours or it must be thrown away. All containers must be labeled with the date and time that the milk was pumped. Containers are supplied by the NICU as no breast milk bags are currently allowed due to likeliness of spilling. Donor milk may be used for infants who have been identified as high risk when mother's milk is not available or insufficient to advance feeds. Donors undergo extensive screenings for HIV, hepatitis B and C, syphilis, and many other diseases. Donor milk is also pasteurized and tested for bacterial growth. We will obtain consent before administering donor milk at any time. Formula is a great source of nutrition when mother's breast milk production is just starting to come in. Our goal is to keep your baby gaining weight, maintaining dextrose levels, and ensuring healthy growth. Many times, mother's breast milk may even be fortified, a process whereby additional calories are added to the breast milk by means of formula. Feel free to ask your healthcare provider anytime regarding the benefits of fortification for your infant. The NICU is often a very noisy and busy place. Between the alarms, babies crying, and the various medical team members on the floor, it is incredibly important that stimulation and noise be minimized. If the infant is resting quietly or sleeping, please do not disturb or wake them. Adequate rest is essential for growth and development. They need to use all of their calories to grow, rather than wasting energy fighting off unnecessary stimulation. Hands-on care is every 3 to 4 hours. It's best to consult the nurse or observe your infant first to determine when is a good time to touch them. Use a soft voice and avoid bright lights in between patient care times. The power of a firm touch can go a very long way. Use your hand to cuddle rather than stroke your baby. You can also watch for signs of stress or overstimulation. Vital sign changes often indicate how well they are handling the stimulation. If the infant is stiff, arching, twitching, sneezing, yawning, fussy, hiccuping, or trying to turn away from the stimulation, they may be giving you the stop sign. We understand how much you love your little one, but be mindful that their job right now is to grow big and strong. When at home, there will be plenty of time for cuddles. There are other activities that you can participate in as well, including temperature taking, diaper changing, feeding, bath time, non-nutritive breastfeeding, and kangaroo care. You may be asking, when can I hold my baby? The best answer is that this varies from baby to baby based on stability and clinical indications. Micropreemies, which are typically 23 to 26 weeks, are generally not held as their skin is very sensitive and temperature is highly unstable due to lack of fat. Physical transfer is stressful for micropreemies, being that they are at high risk for internal bleeding, infection, and neuroabnormalities. Early preterm infants, which are typically 27 to 34 weeks, can be held if clinically stable, with caution. Initially, we will limit holding to half an hour out of the isolette once per day, but can be increased as tolerated. These infants are susceptible to cold stress, risk for infection, bleeding, and line displacement. Late preterm infants, which are generally 35 to 37 weeks, can be held, unless clinically unstable or with certain lines. The biggest question we often get is, when will my baby go home? Usually the baby's due date is given as an estimation for most babies. Depending on gestational age and diagnosis, your baby has milestones to pass and cannot go home until all are successfully met. The speed at which they complete these milestones dictates their discharge date. Discharge planning starts on the first day of admission. The NICU passport and the roadmap to discharge are two documents that pave the way for successful discharge. Nurses will stamp the NICU passport as tasks are completed. Parents are responsible for updating the roadmap as infant milestones are met. These are both hands-on tools to ensure that everyone is on the same page and marking down the days until graduation from the NICU. Prior to discharge, you will need to take our NICU Discharge Class. We will be going over infant CPR, infant care information, and other videos that will help you with your transition going home. Additionally, we will perform a 90-minute car seat test in your personal car seat to ensure that the baby can make the long drive back home without any events. Lastly, you may be offered to room in with your baby. During this time, the parents will stay with the infant in one of our NICU sleeping-in rooms and is usually discharged by the next afternoon, barring no events overnight. The parents will provide all infant care while rooming in, knowing that the NICU staff is just one call away in the case of any event. We want your stay here to be as positive as possible. We realize that this is not an easy time for most parents, whether it's your first or your last. How can you make the NICU a positive experience? Stay proactive in your infant's care. Parents are welcome to participate in daily rounds, ask questions, and get updates. Participate in care of infant whenever possible. Always ask questions if you are unsure about something. We are here for you and your little one. Communication is key. Please communicate if you feel something isn't right so we can fix it. If you feel there is something you cannot talk to your nurse about, then please feel free to speak with the charge nurse. If there was a particular medical team member who really went the extra mile, feel free to give him or her a shout out.
Hi, I'm Kathy, one of the nurses in the NICU here at NMCP. Your opinion is very important to us. Please take the time to tell us about your experience here in the NICU. We've recently updated our method for receiving customer feedback. Smartphone users can simply scan the QR code found throughout the NICU. Comments can also be made through the NMCP internet page. The easiest way is to simply search NMCP in the browser of your choice. Both the QR code and internet options will take you to the ICE comment card, commonly referred to as ICE.
As always, we are here for you. Here at Naval Medical Center Portsmouth, we value your little one's safety. We meet Joint Commission guidelines for achieving national quality standards. We strongly support and provide the ongoing learning and training of physicians, nurses, and ancillary staff. Thank you for watching our NICU Jumpstart video. We welcome you to our NICU, and we thank you for entrusting us with the care of your little one.